Hello everyone, welcome to Wednesday. It's hump day and hopefully you guys are having a good week so far. I wanted to do a very quick video today about TRICARE Reserve Select. I've had a few questions about this, so I want to make sure everyone understands what it is, who it's for, and that everyone understands just some, terminology. Because a lot of these words can get super confusing when you start talking about premiums and deductibles and cost share. And it's like, what the blankety blank is that, right? So I've done the work for you so you don't have to wade through all of these terms and whatnot. So TRICARE Reserve Select is a health insurance plan that I have used. It is a premium-based plan, so that means there's a monthly charge. And it's available worldwide, so even if you're, overseas, you can use it. And it's for qualified reservist and guardsmen, okay? So when we say TRICARE Reserve Select, we are not talking about the free health care that is provided to active duty service members. When we say TRICARE Reserve Select, we're talking about those not on active orders that are in the Guard or the Reserve. Now, if you happen to be in the Reserve or the Guard and you are on active duty orders, you are not eligible for TRICARE Reserve Select. And another important thing to remember is if you are a federal government employee and you are eligible for the Federal Employee Health Benefit Plan, you cannot get TRICARE. And this is actually something that frustrated me because I used to be an attorney for the federal government, which meant that I was eligible for the Federal Employee Health Benefit Plan. And actually that plan is quite a bit more expensive than TRICARE, because if you are, let's say, single without any dependents, you can get TRICARE for less than $50 a month. However, if you do the Federal Employee Health Benefit Plan and you're single without any dependents, that still might be $150 a month or so. So anyway, those are the situations under which you are not eligible for TRICARE Reserve Select. So if you happen to be a guardsman or a reservist on active duty, or you happen to be a reservist or a guardsman that is a federal employee and eligible for the Federal Employee Health Benefit Plan, okay? Outside of those situations, you should be eligible for TRICARE Reserve Select as a guardsman or a reservist, all right? Now, what are you going to pay under this plan? So you're going to pay a monthly premium, and you're also going to pay an annual deductible. And right now, I've already talked about the monthly premium amount, which is about $50 if you're single, no dependent. The annual deductible is actually around $200 if you're, again, single, no dependents. And, if you have a family of four or whatnot, you can definitely look the information up online. You can just go to Google and, type in TRICARE Reserve Select. But I'm also going to put the website link down below for you guys, so you don't even have to go to Google. You can just check the description down below and click on the link from there. But it's tricare.mil, so I'm going to put it right here too in case you want to type that into your browser right now. So you can get some more information there. And you're also going to pay what's called a cost share, and this is basically just a percentage of covered services. So you've probably seen health programs before where the insurer promises to pay, let's say, 80%, and then you have to pay 20%. So that would be what we're talking about when we say cost share. It's the percentage that you are expected to pay. Now, is TRICARE Reserve Select right for you, or should you just go ahead and use your civilian employer's health plan? Well, of course, that's going to be heavily dependent on what you have to pay per month for your employer's health plan. what the cost share is, if any, and what the annual deductible is. So it might be that your civilian employer has a health plan that would require you to meet a $1,500 deductible. So that means you have to pay $1,500 out of your pocket before the health insurance plan kicks in. Well, like I said, with TRICARE, the annual deductible is only about $200 a month. But then again, you also have to look at the monthly premiums. Under, TRICARE, let's say it's $50 if you're single with no dependents. Under your employer's health care plan, it might be $150. So you really have to dig into these health care manuals or brochures and make sure you're checking things like the monthly premium, the cost share, and the annual deductible. So those are the three things you're really going to want to check into when you're weighing whether you should use TRICARE Reserve Select or your employer's health plan. Now, how do you enroll? Let's say you've decided that you want TRICARE Reserve Select. How do you enroll? Well, you have to enroll online or by phone. And you can actually call 1-800-477-8227. And this number is current as of 2020. But of course, if you're watching this at some other time, just make sure that you also visit the tricare.mil website and make sure the number's still good. Or you can visit the TRS enrollment page from the tricare.mil website, and you can enroll that way as well. Now, like I said, I've been on this program, and I found that it was really the best program overall in terms of, the cost. And I didn't have any trouble finding in-network providers. But of course, that's another thing you're going to want to do, because if you live in, let's say, a more, rural area, there might not be very many, network providers near you. And, when you go to a network provider, you're going to pay less than going to an out-of-network provider. So it's always just a good thing to go to the TRICARE Reserve Select website and kind of, search by zip code and whatnot and see how many providers there are near you. So that's also something that should kind of be calculated into your decision. And with all of that said, I'm going to let you guys check into all of this and make the decision that's best for you. And of course, I'm here to help answer any questions. If you have any, just drop those down below. And I will see you guys next time.